Without adequate transportation resources, the Directly Observed Therapy Program (DOTS), currently being run by the National Tuberculosis Programme, has been plagued with a number of challenges in reaching registered and non-registered tuberculosis patients, primarily in the hinterland regions. The DOTS initiative was implemented to allow healthcare workers to visit tuberculosis patients at their homes or elsewhere to supply medication and monitor their compliance. Highlighting the hurdles in undertaking the program's tasks was Director of the National Tuberculosis Programme, Dr. Jitendra Mohanlal, who during an exclusive interview with Nightly News on Thursday said that ending tuberculosis in Guyana hinges on how much of the appropriate must-have resources are provided, since the investment of hard work and determination by committed staff is already evident in the fight to end this preventable and curable disease.
Transportation, you see, with the DOTS program, you have to reach to the patient. The patient don't come to you all the time. Guyana is not a country like maybe the Dominican Republic, where a lot of patients go to their site to access treatment and this. But health seeking behavior in Guyana is such that you have to keep going behind them. It takes a lot of resources. We have to conduct clinics, and still help our colleagues in the regions.
Dr. Mohanlal further disclosed that the program also faces challenges with human resources. In some instances, one personnel is assigned to undertake multiple roles, since some vacant positions are yet to be filled. Despite these shortcomings, the National Tuberculosis Program has reported that overall the incidence of the disease has been on a constant decline. The incidence rate of tuberculosis in Guyana stands at 55 per 100,000, an increase from 50 per 100,000 achieved in 2021. Additionally, in 2019, the incidence rate peaked to 66.5 per 100,000. Last year, in excess of 3,000 tuberculosis tests were conducted. Overall, there are 414 persons currently infected with the disease, including newly diagnosed patients and those who would have relapsed. To further ensure that TB treatment and care services are more accessible to persons, Dr. Mohanlal announced the resumption of the chest clinic at the Enmore East Coast Demerara Polyclinic, slated for next month, as well as plans to establish a testing and treatment site on the east bank of Demerara.
So by next month, we'll have that chest clinic on every third Thursday, right, with a doctor assigned there from the TB program, and also you'll have 3 staff from the East Coast who will be working with patients. So services will be brought closer. We also hope we're working on the East Bank to have a site at Tuesday, right? That will bring services closer to persons from the highway.
To commemorate World Tuberculosis Day, healthcare staff facilitated a number of sensitization sessions at the Georgetown Chest Clinic and at the Vridenhoop Stalin. Timeka Rodney reporting for the HGP Nightly News.